Deja Tacho, and my project's on job stresses for nurses. Introduction. On this introduction slide, I have a picture of a nurse who looks overwhelmed with the amount of work she has, and then I also have a picture that says, "Can you handle it?" I chose this topic because I wanted to know what are the major stresses that nurses face on a day-to-day basis. In addition, I wanted to know what are the challenges and obstacles nurses face, and if I would be able to handle them once I become a nurse. I think it's important to understand and know the stressors that nurses face so we can improve their environment, which can lead to improvement in the quality of care they give to their patients. Also, if we can lower the stressors, then more nurses will not experience burnout syndrome. My research question was, what are some of the stresses that nurses encounter during their shift? Theories. The quality of care theory was the only theory that I found. It was made by the Committee on the Quality of Healthcare in America and Institution of Medication. The quality of care is a theoretical framework that was talked about in the article. This theory is an ongoing effort focused on assessing and improving the nation's quality of care. The Committee on Quality of Healthcare in America laid out a vision for how the healthcare system and related policy environments must be radically transformed in order to close the chasm between what we know to be good quality care and what actually exists in practice. Among the articles I found, three were quantitative and three were qualitative. The qualitative studies include one correlation cross-sectional design, one comparative design, and one non-experimental design. Within these designs, surveys and questionnaires with various stress scales were gathered. That's how they gathered their data. Then for the qualitative study, there was two cross-sectional studies and one qualitative research. Within these designs, there was interviews were conducted using questionnaires as well, and they also used different stress scales to gather data. For the results, I decided to include the stressors for nurses that each article addressed, which are on the slide. During a shift, a nurse may experience work overload, material shortage, death of patients, conflicts with doctors, and staff shortages. All of these things would contribute to a nurse's stress. For example, when the hospital has a staff shortages, more nurses must double the work they have to do, which can lead to work overload, which can cause an increase in those nurses' stress. Also, one of the articles showed that night shift nurses have more stressors than a day shift nurse does. Night shift workers experience insufficient sleep, tiredness, and disrupt sleep patterns due to the constant alternating of sleep patterns from work and rest days. In addition, there are stresses that nurses face from the hospital. There's stresses that nurses face away from the hospital, such as fighting with their spouse, marital problems, death of family and friends, or children because they need a lot of attention and supervision. Among the articles I read, the most common limitation given by the authors of these studies was that the results may not be generalized to the entire population. Some of the other limitations included subjectivity of participants and bias because the surveys were being answered online, so the researchers could not tell if the participant was lying or telling the truth. In addition, some of the studies lacked randomization and they lacked a control group. Lastly, another limitation that came up in these studies were some small sample sizes. The most common recommendation given by the authors was to repeat the studies over a wider geographical area because many of the studies could not be generalized for the entire population, which doing the studies in a larger area would help with that limitation. The authors also suggest that the study should be done with a larger sample group. Also, some of the studies needed to change the designs to a quantitative study for the same topic, just to compare qualitative with quantitative. In addition, changes in the study design were also recommended by authors using a longitudinal and cohort study. In summary, I think stressors that nurses face can be addressed and lowered to improve the quality of patient care and to prevent burnout syndrome. Burnout syndrome is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. It occurs when you feel overwhelmed, emotionally drained, and unable to meet constant demands. Burnout syndrome can make you vulnerable to the flu and cold, which can lead to a shortage of staff and cause work overload for the other nurses. Working environment stressors include overwork, individual conflict, shift work, dealing with death, lack of mental support, conflicts with doctors, and then experience these in a high level every day. If we can improve any of these, we can lower the amount of stress put on nurses. In addition, one article addresses that having a higher emotional intelligence can help lower stress. The components of emotional intelligence are self-awareness, self-control, self-motivation, empathy or social consciousness, and social skills. Educational classes based on these components of the emotional intelligence can be effective in reducing stresses in nursing. This is my reference or works cited page for the articles and information I gathered.